Liver transplantation for biliary atresia can either be performed as initial treatment, called primary liver transplant, or can be performed after failed Kasai hepatoportal enterostomy, called salvage liver transplant. The current standard in the US is Kasai first and liver transplant only if that fails. But is this really what we should be doing? My name is Alex Halpern, a general surgery resident at George Washington University working with Cincinnati Children's, and this is an article that you should know. Adams et al. Performed a retrospective cohort study looking at a national database from 2002 to 2021. They looked at children with biliary atresia who underwent either a primary or a salvage liver transplant, and they split these children into three groups. The first group had a primary liver transplant. The second group had an early salvage liver transplant before the age of 1, and the third group had a late salvage liver transplant. And what did they find? They found that children who had an early salvage liver transplant and children who had a primary liver transplant had similar outcomes. They also found that children who had a late salvage liver transplant had improved graft survival. Now, why is this important? It's important because it shows that children who have a salvage liver transplant have similar, if not better, outcomes than children who have a primary liver transplant, and backs up the current standard in the US of Kasai first and liver transplant only if needed, especially because some of these children that undergo the Kasai procedure will never end up needing a liver transplant. Let us know what you think.